Now they're here.
Recording in progress.
So I have a question for you. Are you able to access D2L and find out what assignments you haven't done?
Yeah, I'm pretty sure we can see that. If we go to grades, it'll just show us what we haven't been graded on yet.
Okay, because I received several emails Tuesday asking me what assignments you might be missing. What's from students asking what assignments you might be missing. You just go to grades and from there you can figure out what assignments you're missing.
Yeah, it'll show you a grade like out of a number, but if you haven't handed it in, it's just like a dash, so you know that it wasn't handed in.
Okay.
Um,
All right. Yeah, I thought that's what it did. And I just wanted to make sure because what I see and what you see are different. But I think I've seen that before. A student has shown me. So if you think that you might be missing some assignments, or if you want to check, go into your grades on D2L.
yeah, I think all of them have like dashes on them. So
All of them or ones that
Well,
you don't have
the ones
scores
that
for?
aren't done or that we haven't had like assigned yet.
Okay.
So I guess like it would literally have to have like a 0 out of so and so.
Okay. Okay.
If like you actually missed an assignment, because I know when I was missing something, it said I had a 0.
Okay. Because yes, I think I received 4 emails and I have had a really busy couple weekdays and I haven't had a chance to respond. But when I saw those, I thought, Art, I thought you could look on D2L and see what you were missing. Are there any questions about that? If you go online, what you should have done up until now for lecture, you should have the smart book assignments for 1 through 3, chapters 1 through 3, the practices for 1 through 3, and the quizzes for chapters 1 through 3. You should also have the lab exercises submitted up through lab exercise 7.
So lab exercise 7 is before our midterm.
Was it before midterm?
I thought you said last time that lab exercise 7 we shouldn't do before the midterm. That's not a midterm grade.
Well, you know what, that it was last week. So what I'm just saying is up to right now, that's what you should have done because that was due last night. Does that make sense? I haven't submitted midterms. I think the deadline is in about 4 days. But I won't include that, but that's where you should be if you're not missing any assignments. And I kind of assume that you as students know what you've done and what you haven't done. And that you can go into
Okay.
the grades on D2L and determine what you haven't done, or what score you've done, what grade, what assignment you've done, if there's a missing score. And then you can report that to me and I can figure out why you don't have a grade there.
Okay,
Go ahead.
Professor, and this is Miranda speaking. I was just
Yeah.
gonna ask you if you could open lab 7 for me again last night. I wrecked my car over the weekend, so
Ouch. You know what? I saw your email and it was late last night. I didn't have a chance. I just saw lab exercise 7. I'm guessing that was you.
I did not email you. It completely skipped my mind about lab exercise 7 last night because I went and got my new car yesterday.
Okay, good. I'm so sorry. That really stinks.
It really did stink. It was my brand new 2020.
Ouch. Ouch. Oh,
Yeah, so it was pretty hard damage to total of 2020.
ouch. 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 Ouch.
Did you say lab exercise was due yesterday, 7?
Yes. Because we did
Oh.
last week in lab. So whatever we do in lab today is due next Wednesday night at midnight. Whatever we did in lab last Thursday was due last night at Wednesday at midnight.
Because I was so, for some reason, I'm just going by, like, you know how it says what's due? I just keep following that.
That's not Wiley, it's only McGraw-Hill. And I can't
Okay.
link those due dates for Wiley to McGraw-Hill. I can't
Okay.
link those there. That's not something that I have control over. But the only Wiley assignments you have right now are specifically for lab exercises. And whatever lab we cover today is due next Wednesday night at midnight.
So labs 8, 9, and 10 are all due next Wednesday.
Yes,
Okay.
yes. And so if you're looking, as we go through from week to week, so week of September 6th, this was the lab exercise that we did, lab exercises 3 and 4. The lab exercise here was due the following Wednesday at midnight. These virtual labs were part of that also. Another thing, you can look at the syllabus, and the syllabus will tell you what's due for lab. So if I'm looking here, it also tells you what the due dates are for different things. If you're worried that you're missing something, go into your grades on D2L and see. Or if you want to make sure that you have everything turned in, go into D2L and look.
It says for we can't like click on it, but with lab exercises 8 through 10, I'm seeing like a thing for lab quest 3. I'm assuming we're waiting to start that.
Yep, so it's gonna cover, let me remember right here, just a second. I set it up the other night. It's gonna cover lab exercise 7, 8, 9, and 10. The next lab exercise is going to cover lab exercise 16, 17, 18, 20, and 21, and 22. They're shorter exercises. Are there any questions right now?
Can the labs be opened up, or is it that's
I can
it?
reopen them, but I need you to tell me what ones you need me to open and when you'll have them done. Because I have to go in and individually do it with Wiley. I have, and so I need to know when you'll have them done approximately. And I can reopen them for you. Other questions?
I just wanted to double check with chapter 7. Chapter 7 quiz is due the 18th, but then the smart book and practice aren't due till like a couple weeks later.
You know what? I will extend out both of those.
Okay. I just wanted, I didn't know if we
yeah.
were done with that yet.
We are not done with it, so I will extend it out. Okay.
And I needed lab 6 and 7 to be extended out.
Well, I just need you to tell me Lakeisha, I need you to tell me, I need you to send me an email and tell me which ones to extend out and when you will have them done, because then I'll know how long to extend them out.
Okay.
Okay. So I just got something from one person here in class, and I know they're here. I haven't given you your first case study yet. So with the exception here, I haven't done that yet. I will do that after we finish chapter 7.
Okay,
I haven't,
thank you.
yeah, I haven't done it because I wanted it to cover the bone. And because we haven't finished covering it, I don't want to give you a case study on it, expecting you to know the material.
Thank you. I saw the syllabus and got very concerned for a second there.
Yep, I understand. I understand. Other questions or issues? I will send you out an email when I've opened up that case study. I will actually, let me try to get it done this weekend. And I'll send you out an email when I've opened it up. But yes, I'll extend out lab exercise 7 for you. So I just need, yeah, if you're missing any of the lab exercises, send me an email telling me which ones, like Jesse just did, telling me which ones and when approximately you'll have them done. Other questions or issues?
There are 6 different labs I see here on D2L, and with my looking at my grades.
Can you, Lakeisha, so I need you, are these labs that you're missing?
Yeah, I just was, I didn't know if I was looking at, I didn't know it was like 6 different ones, so I didn't know. Okay, I'll just put it all in the email.
Okay.
Okay.
There's another one. Yep, Miranda, I heard you, and yes, I'll do that. Bear with me just for a second here. So if you go in, there's several things listed under lab exercises 8 through 10. I trimmed down the number of questions for each specific lab Wiley exercise here. They're still extensive. And what you'll see is they're extensive for a reason. And the reason is because there's a lot of material here. So if you look under this document right here, this Word document, it will tell you what you need to know about each bone. A lot of anatomy is learning the bone structures, learning the muscles, learning the nerve names. With the bones, a lot of it is learning the bones and learning certain structures on the bones. And so some of this is not just a list, some of this gives you some ideas about how to remember and memorize this. But all of these different processes are what you need to know about a given bone. And so today I want to cover that. We're going to cover a little bit about the histology of bone. So lab exercise 8 is talking about long bone anatomy and the histology of bone. Lab exercise 9 is talking about, and I have to remember now, it's talking about the axial skeleton and bony markings associated with the axial skeleton. Lab exercise 10 is the appendicular skeleton, and we'll go into that here in a second. Go into that in a lot more detail. You will see there's a lot when you there's a lot to know. Part of the reason that I gave you some extensive assignments here is because there is so much to know here. So this one contains 30 questions. And it's referring to histology and bone formation. Lab exercise 9. Is specifically looking at the skull and overall skeletal system. It's looking at the axial skeleton and the skull and the overall skeleton. A lot of these questions are one answer questions. Some of them require more than one answer, but most of them are one answer questions. Oh shoot, let me go back. So this is we're specifically looking at the appendicular skeleton, which is your arms, your legs, your pelvis, and your shoulders. And we'll talk more about that as we go through the PowerPoint. There are a lot of questions. Do as many as you can and recognize that I round up. Questions that have multiple answers are going to be worth more than questions that just have a single answer. But I think honestly with anatomy, a lot of learning is repetition, 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 repetition. And that's also why the lab exercises are more extensive. So lab exercises 8, 9, and 10. Some of this is a review from what we started the other day in lecture. Some of it isn't. But referring to the anatomy of long bones, and really all bones contain cortical compact bone on the outer surface and spongy or cancellous bone in the center space. The ends of the bones, remember those are called the epiphyses, and the shaft of the bone is the diaphysis. Many times when we're referring to anatomy, when we're referring to anatomical position. So the bone, the end of the bone that's closest to the midline is the proximal epiphysis. And the part of the bone that's farthest from the midline is the distal epiphysis. The epiphyseal growth plate is the hyaline cartilage that's located at the metaphysis. Remember, that's where the diaphysis meets up with the epiphysis. Articular cartilage is hyaline cartilage that's going to cover the epiphyses and make them smooth. If you remember, the hyaline cartilage is the cartilage that's very glassy in its appearance. It's very smooth because it allows for a frictionless or minimized friction and resistance at the joints. So where in the long bones do you find hyaline cartilage? Where in the long bones do you find hyaline cartilage?
Nose.
Well, where in the long bones? Where in the long bones? You do find it in the nose a little bit. Well, where do you find it in the bones?
I'm sorry, what are you looking for us to find in the bones?
Where do you find hyaline cartilage in the bones?
And the epithelial growth plate or the articular cartilage?
Good job, Miranda. The medullary cavity is the cavity within the diaphysis containing yellow marrow. In young children, this contains many of these diaphyses contain, or medullary cavities contain red bone marrow. Later, it gets allocated or to the ends of the bones. But in adults, this area contains yellow bone marrow. It just slowly gets shifted, and we'll talk more about that in lecture. Yellow bone marrow is a fatty tissue that acts as a reserve fuel supply. If you remember, we had periosteum that covered the outer bone. We have endosteum that covers the marrow, the inner lining of the marrow cavity. It's reticular connective tissue because much of this inner lining is involved in the lymphatic system. And if you remember, reticular connective tissue is the majority of it is found in the lymphatic system. So the endosteum is made of reticular connective tissue. Nutrient foramina are holes in which blood vessels and nerves enter the bone. The organization of compact bone is a tight organization of osteons and lamellae. Osteons are this ring-like structure, almost cylindrical ring-like structure. Let's describe it that way. So it's a cylindrical ring-like structure that contains sequential rings that are arranged around a central canal. The rings are called lamellae. So these are concentric rings that are arranged around a central canal. Each of these outer rings are connected through what are called caniculi. Caniculi are little canals. I think the word actually means little pin-taped canals. Central canals are connected to one another by perforating canals or Volkmann's canals. See right here. Like the inner lining of the bone or the medullary cavity, these canals and perforating canals are all lined with endosteum. So the nutrient foramina, remember those are the holes that bring in the blood vessels and the nerves. Nutrient foramina open into perforating canals. perforating canals, opens into perforating canals, which lead into the central canals. And the lamellae are concentric rings around the central canals. Within each of these rings, so this is this ring, let's say this ring right here, or this ring right here, magnified. So here's one lamellae, here's the next lamellae, here's the next lamellae, here's the next lamellae. Osteocytes, if you remember, those are the kind of maintaining cells of bone that reside in those lacunae, those cavities, are connected to one another in the rings by caniculi, those little tiny canals, which allows the osteocytes to receive nutrients from the central canal and eliminate waste. So nutrients and waste are moved through the caniculi from the central canal to the osteocytes. And when the individual cells need to eliminate waste, it's passed through the caniculi again back to the central canal. Any questions about this? So this is all compact bone. A little higher magnification, a little bit more detail. Here's an osteon is from the outer ring of this to the other end of the outer ring. And the individual rings are the lamellae. And the little dark patches are the osteocytes residing in the lacunae that are connected to each other and to the central canal via the caniculi, or caniculus, meaning singular. Any questions about how cortical bone or / compact bone is organized? Outside of osteons, the bone contains other lamellae. It contains circumferential lamellae and interstitial lamellae. The circumferential lamellae is the outer rings around the long bone. So if you think, the easiest way for me to think of a circumferential lamellae and remember what it is if I think the circumference of a circle, well, how do you define the circumference of a circle? How do you define the circumference of a circle? I know, someone tell me, how do you define the circumference of a circle?
That distance from one end of it to the other.
Yep, so it's the outer, it's the outer periphery of that circle. So the distance from one side to the other side. The circumferential lamellae are on the outer edge of the long bones. That's how I remember it. Osteons are constantly being developed. They're constantly being remodeled. Remember, we talked about how bone is constantly being broken down and built up. And when it's built up in a series of osteons. However, because bone can't just keep developing one osteon after another, or we're going to have really, really big bones. When bone is resorbed, when it's broken down, we break down osteons. When we build up bone, we create new osteons. So in between the osteons that are here in the bone, we have interstitial lamellae, which are the remains of older osteons that have been somewhat broken down. So interstitial lamellae are the lamellae in between osteons that are made of old osteons that have been partially broken down. In comparison to, first, any questions about cortical bone organization?
Not at the moment.
Okay. Cancellous or spongy bone is a little different. It's not compact. So it's a series of trabeculae and spicules. Let me. So here's my trabeculae. And trabeculae means bars. Trabeculae means bars. There are little connections or little tinier pieces of bone they're called spicules. Spicules. I think that's about right. So trabeculae and little tinier pieces, spicules. If you cut through one of these cross sections, one of these trabeculae, you did a cross section through it, what you would see would be a mini osteon. Here's your osteocytes. Here's your caniculi. Here's your individual lamellae. One thing, what do you not see here? If I'm going to refer to this as a mini osteon, what do you not see here that you see in an osteon?
Are we missing a nucleus?
Not really. This is the every one of these cells is a nucleus. Remember, all these osteocytes are individual cells, and they each contain a nucleus. What else could we be missing? Go back and look at what an osteon looks like on one of the other slides. What are we missing?
Central canal.
We're missing the central canal, right? We don't have central canals in spongy bone. Why do you think we don't have central canals? What's carried in the central canals in compact bone? Somebody go back and look and tell me what's carried in the central canal that we don't have here, because we don't have central canals.
We're lined with endosteum.
They're lined with endosteum. What's in them?
Fluid.
Blood vessels.
Blood vessels and nerves. So we don't have blood vessels and nerves. Why do we not need blood vessels and nerves here in the trabeculae? What's in the cavities that are here? What fills up these cavities in bone within the body? If you look here, it tells you.
Vessels and bone marrow.
Yeah, bone marrow. So, and what bone marrow, the majority of bone marrow is blood. So we don't need blood vessels here because all of the blood is in very close proximity to the cells anyway. If you see that here, this is a cross section right here. If we take a look at this, all of these cells right here, if there's blood in all of these little spaces, all of the cells are right next to the blood anyway. They don't need central canals because we don't need blood vessels that are connected up that way. Because there's blood everywhere in here. In compact bone, we only find blood vessels and blood running through the central. I'm taking Jake to the hospital. I thought he was at the hospital. Okay. Okay. All right. I'm sorry. Our neighbor is going through. He's our upstairs neighbor, and he's going through cancer treatments right now, and they've been really quite nasty. He said that he was, from what I understood, he was going to the hospital last night, and I'm guessing they sent him home. But he's going back again. My mother's taking him in right now. So back to this, cortical bone has a blood supply moving through it via the central canals, because all of the trabeculae in the spongy bone are in close proximity to the blood anyway, because of where the red bone marrow is and where the marrow is. There's no central canals in spongy bone. So a histological section looking at the spongy bone. Here's our trabeculae. And within the trabeculae are osteocytes within the lacunae. Remember that lacunae are little cavities. And then we have red bone marrow and yellow bone marrow. Any questions about spongy bone?
No.
So comparing the two, spongy bone, lots of different spaces, because that's where the name comes from. It looks like a sponge, very hard sponge, but a sponge. And in compact bone, it's very tightly bound, very compact. Moving on, the skeleton is divided into two parts. We have the axial skeleton, which includes the skull, the vertebral column, and the thoracic cage. The appendicular skeleton, if you think about appendages, meaning your arms and your legs, the appendicular skeleton is the shoulders, the hip bones, and the bones of the upper limbs and lower limbs. So an overview, we have the skull, the mandible, the sternum, the ribs, the vertebrae, the sacrum, the pelvis, which consists of two bones that are with each half being a fusion of three bones, which we'll talk about later. The femur, the tibia and the fibula. The tibia is on the inside. The tarsals and the metatarsals. Of the shoulder joint, we have a scapula, the clavicle. What makes us different from my cats and my dogs is that we have a clavicle that allows us to keep our shoulders separate. A humerus, a radius, and an ulna. Remember, we always look at things in anatomical position. So head up. And this isn't exactly an anatomical position, but it does give you an overview of the bones. Head up, palms forward. Looking specifically at the skull, we have 8 cranial bones that make up the cranium, which is where the brain is enclosed. We have 14 facial bones that form the face, and have no contact with the brain. So looking at the frontal view of the anterior view of the skull, the frontal bone, the nasal bone, the sphenoid bone. We'll go into more detail with these, with individual bones here in a moment, but the sphenoid bone, the parietal bone, the temporal bone. Sphenoid bone is about right here. The sphenoid bone here is about right here. Parietal bone is right here. Temporal bone is down here. The ethmoid bone is a long bone that is going to extend into the skull area, into the cranium area a little bit, but it's about like this in size. The maxilla is the upper part of the mouth. Zygomatic bone makes up the majority of your cheekbone, makes up at least half of your cheekbone, and we call it actually the zygomatic arch is your cheekbone. The mandible, your lower jaw. The incus, the stapes, and the malleolus are the three inner bones within the ear. On the very back of the skull, or the posterior side of the cranium, we have the occipital bone. I have a palatine bone that's right, makes up the most posterior part of your palate. And the lacrimal bone, which is about right here. Right here. And at excuse me, a side view, the maxilla, mandible, nasal bone, frontal bone, temporal bone, occipital bone, and parietal bone. So the bones of the cranium include 8 bones. There's one ethmoid bone, one frontal bone, 2 parietal bones, 2 temporal bones, 1 sphenoid bone, and 1 occipital bone. The better you can learn these bones, the easier your future anatomy and future things that you need to know are going to be. Because anatomy is oftentimes, I would think of it as a word puzzle. Things that are named similarly are usually close together. Many things that are close together are named similarly. For example, the lobes of the brain, the frontal lobe is right here. The parietal bone is right, the parietal lobe is right here. Temporal lobe is right here, and occipital lobe is right here. So the better you can learn, the easier it will be. The more you can learn right now, the easier it will be overall. Looking at the internal area of the cranium, the frontal bone. Sphenoid bone is actually, you don't see it here. Sorry, you don't see it here, but it's not colored, but it's right here. Parietal bone. And the occipital bone. So this is looking from a superior view into the cranium base. So the bottom, and let me show you, bear with me just for a second. So I have a few models that I've purchased. Let me show you these. So looking at my skull here. My frontal bone up here. My parietal bones. Parietal bones. Occipital bone back here. The temporal bone. The temporal bone. The zygomatic bone. Zygomatic bone right here. Maxilla. The mandible. Oh, if I take off the top, this last picture we were looking at was the internal view here. So the most posterior part, the occipital bone, the parietal bones, the temporal bones, the sphenoid bone, the frontal bone, and the ethmoid bone. In between the bones of the cranium, we have sutures. And sutures are immovable joints. We have a coronal suture. If you remember, we talked about a coronal section or a frontal section. It's where the coronal suture is. So remember, a frontal section is essentially separating the anterior plane from the posterior plane. So a frontal or coronal plane right here would separate the anterior from the posterior. That's the way that I remember that. Here we have a squamosal suture. Call it a squamosal suture. It's connecting the sphenoid bone, the temporal bone with the parietal bone. And squamosal means really thin. Remember, you had squamous cells. Do you remember what described a squamous cell?
It's flat.
It was flat. It was really thin. It was flat. This suture is really quite feather-like and really quite thin. It actually is made to allow, it's probably the most flexible of all of these sutures, in that it's designed to be able to have a little bit of give to it. That's why it's called the squamosal suture. Or the squamous suture. The lambdoidal suture on the very back looks like the Greek letter lambda. It looks like the Greek letter lambda. That's where it gets its name. It's a lambdoidal suture. So looking at my skull here. Here's the front of my skull. Right here is my coronal suture. My squamosal suture or squamous suture. On the very back, starting about right here, coming down, here's the lambdoid suture. So coronal sutures connecting the frontal and the parietal bones. The lambdoidal sutures connecting the occipital bone and the parietal bone. The sagittal suture is connecting the two parietal bones here at the very top. Do you remember a sagittal section going right through the midline? So the sagittal suture is right down the midline of the skull here on the top. And the squamous suture is the junction between the temporal bone and the parietal bone. Any questions about the sutures? So lambdoidal suture, sagittal suture, here's the occipital bone, here's the parietal bones, here's the frontal bone. Coronal suture. Babies don't have fused sutures overall. They're over time, their sutures will form, but at birth, many of them are only partially fused, if fused at all. The result is that the skull plates or the plates, the bones of the cranium are not bound to one another. In the most unbound places, or the places where there's the biggest gaps between the bones, this is looking at the superior view here. We have what are called fontanelles. Fontanelles means little fountain. And we have an anterior fontanelle where the frontal bones will connect with the parietal bones. We have a posterior fontanelle where the parietal bones will connect up with the occipital bones. And we have a mastoid fontanelle, which is right where the occipital bone is going to meet up with the parietal bone. And then the temporal bone, the sphenoidal fontanelle, where the temporal bone will meet up with the sphenoid bone, the frontal bone, and the parietal bone. What do we also call these little spots? I know most of us have probably seen a baby at some point. What do we call these little spots?
Soft spots.
These are soft spots. From what I understand, and I've never actually seen it, but from what I understand, you can tell when a baby is dehydrated by looking at this fontanelle, if it's depressed. You can also measure a pulse at these areas. You can feel a pulse. I'm trying to think if there's other things that you can detect here. I think that's much as I know. How long do they usually last before these bones fuse together to the point of where you don't have these little fontanelles? I think by about the age of 2, they are completely fused. Why do you have them? Why do babies have them?
So the head can pass through the birth canal easier.
Yep, that's a major part of it, is so that the head can pass through the birth canal. Another reason is because the brain is still growing. I know 2 friends who have had babies with what's called craniostenosis. Is it some? I think that's it. Cranial stenosis. Bear with me. I'm going to look it up because I want to make sure I'm spelling it right, because I don't think I am. Yeah, cranial synostosis. I knew I wasn't. Synostosis. What this means is that at birth or earlier than they should, the sutures have already fused. And the result is if it's not taken care of, is that babies can sustain brain damage from it. Because their brain is still growing. And it has nowhere to grow if these plates are already fused. And so what they do is go in and surgically break up the skull cranium bones again. So any questions about the fontanelles and the bones of the cranium? Let's take 10 minutes and come back to right here. No, it's not. No, it's not. I think it's about the same. I don't know if it's actually buy it. But no, I know it's, I priced something. Maybe. Don't give me too much credit. Okay, so 14 facial bones. There's 2 bones that make up the maxilla, 2 bones of the nasal bones, 2 of the nasal bones, 2 of the lacrimal bones, right here, where your tear ducts are. Lacrimal means to tear. So lacrimal bone is where your tear ducts are. Zygomatic bones, palatine bones, remember those are in your, towards the very back end of your palate. Inferior nasal concha. Concha meaning like a curved in shell. You have 3 of these nasal conchas. So you have an inferior nasal concha, you have a middle nasal concha, and a superior nasal concha. The inferior nasal concha is its own bone and not a structure on another bone. It's an individual bone. The vomer bone is this little tiny tip of a bone right here. Little tiny bump, ridge. And then the mandible. Many bones have markings that serve as passageways. For blood vessels, nerves, or attachment points for tendons, muscles, and ligaments. It is a really good idea to remember these and memorize the meanings of these, because you're going to see them over and over and over and over again. A condyle is a large, smooth, rounded, articular surface. The head is a prominent, rounded epiphysis. Remember, epiphysis meaning the longest, the ends of a long bone. Trochlea actually looks like a spool. Trochlea means spool. It's as like a spool of thread. It's a pulley-like articular process. Alveolus, the pits in your maxilla and mandible where your teeth are going to insert. Your fossa, fossa meaning a shallow depression. Sulcus, a narrow groove. A crest, a prominent ridge. Epicondyle, a projection that's right next to a condyle. Remember, epi means on top. A line, it's a low ridge. A process is any marked bony prominence. Ramus is an angular extension, like it, or arm. A spine is a pointed, slender-like process. Trochanter, massive rough projection found only on the femur. Tubercle, tuberosity. Canals, lots of canals, especially in the skull, for which nerves and blood vessels move through. Fissures, Foramina, we're going to see that. Remember, we saw the nutrient foramina. Foramina means whole. So we're going to see a lot of foramina, which are little small passageways or passageways through bones. And a sinus, a cavity or a hollow space in the bone. Looking at the front of the skull, there's lots of different bony markings. And you'll see if you look at the list that there's several that you're responsible for knowing. If I were you, what I would do is I start learning them in pairs. Right here, and a lot of these, if you remember, I told you that a lot of anatomy is a word puzzle. A lot of things are named the same thing, or there's a pattern in the way they're named. Here in the frontal bone, we have a supraorbital foramen. So super meaning above, orbital meaning above the orbit. So supraorbital above the orbit. Foramen meaning a hole. So this is a little hole that's above the orbit. The supraorbital margin right here. Down here on the right below the eye is the infraorbital foramen, meaning the orbit below the, the foramen below the orbit. Supraorbital foramen, infraorbital foramen. Looking into the eye orbit, you have a superior orbital fissure, and below it you can't see it very well in this eye, but you can see it much better in this eye. Here's the inferior orbital fissure. Right here's the optic canal where the optic nerve is going to come through. Inferior nasal concha. Middle nasal concha. And up towards the top, you have a superior nasal concha. If you look at this, the tip of your nose is not made of bone. And you can probably figure this out with, and I think someone mentioned it. I can't remember who mentioned it. The nose is partly hyaline cartilage. The whole tip of the nose is cartilage. So this whole area is cartilage. I was born with a cleft lip and palate. And what that means is that if you remember, it said that the maxilla is actually two bones that come together and fuse right here. What that means is that that failed to close. And so my palate was actually open, and we'll see it on another figure here in a moment. The result was that I was essentially a facial defect. And I have had my nose surgically broken many times to reshape it. And at this point, I don't understand why people would get plastic surgery just to get plastic surgery on their nose. Because I can say it's a pretty miserable deal overall. But I come to the understanding that when people accidentally get their nose broken, many times it's a separation of the cartilage and not the bone. It's possible to break this septum, the perpendicular plate that runs back here. It's part of the, here's the vomer, the perpendicular plate. That's a really, really good break. But many times it's when someone breaks their nose, a lot of it is just, it's a separation in the cartilage. It's a breaking of that cartilage. And not so much a breaking of the bone, because the bones are fairly deep. Outside of this nasal bone right here, the bones are fairly deep in the nose. Let's see here. The alveolar processes where the teeth are going to come into the maxilla and the mandible. The mental foramen. Have you ever seen the sculpture of the thinking man? Who is like this, is like, because the mental foramen is right at that where you go, mental foramen. Specifically at the orbit. This is a nasolacrimal canal. If you've ever noticed that when people cry, their nose runs. Because the tears can run down this nasolacrimal canal into your nose. The infraorbital fissure, the superior orbital fissure, the optic canal where the optic nerve is going to come through. Ethmoid bone back here, really, 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 really thin bone. If you look at a real skull, see here. Oftentimes the ethmoid bone is broken out. Many times it is broken out, and I've got to see one here. If you look here, many times it is actually broken out, because with real bones, oftentimes we like to point at things, which is okay, except when the bone is really, really thin, and we break through that bone because we point at it way too many times. Very, very thin bone. The way that I tend to remember that, and no pun intended, and I'll use the default that I have a niece and a nephew that were adopted out of Ethiopia, and I sincerely adore them. And I'm bringing that up because how are you going to remember that that's the ethmoid bone? The way that I remember the ethmoid bone is that it's really, 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 really thin. If you, I know most of you, I don't know how old you are, but the majority of you are much younger than I am. And when I was about, I don't know, 13, maybe in my late teens, somewhere in there. There was a famine in Ethiopia, and a bunch of musicians got together and put together a song called "We Are the World." We are the world. We are the something. I can't sing, so I'm not going to try to sing it for you. But that's the reason that I can remember that bone, is because if I think ethmoid bone, Ethiopia means really, really, really thin bone. That's the way that I remember it all the time. So lacrimal bone, so nasal bone, maxilla, lacrimal bone, ethmoid bone. Looking at this side view, lateral view, nasal bone, maxilla, lacrimal bone, ethmoid bone. Here's the nasal lacrimal duct. Here's the infraorbital foramen, the mental foramen down here in the mandible. The frontal bone, parietal bone, the sphenoid bone, temporal bone, occipital bone. Of the mandible, there's some different points to it. Their coronoid process looks like a bird's beak. Coronoid means a bird's beak. The mandibular condyle, which fits in the mandibular fossa of the temporal bone. We're looking at it. Here's mandibular condyle, coronoid process. If I dislocate the jaw here, mandibular fossa of the temporal bone. When you hear of people who deal with TMJ or temporal mandibular joint, what they're having problems with is that joint right there. The external acoustic meatus. This is your acoustic meaning sound, external meaning on the outside, meatus meaning a large canal. This is your ear canal. Styloid process, styloid meaning a writing instruments. So this is a really sharp little points. On this guy right here, on my skull right here. Here's the mastoid process right here. Right deep to it and more, a little bit more internal is this little sharp little point. That's my styloid process. Looks like it could be something that you could use as a tip to write with, dip it in some ink and write with it. Styloid process. Here's a sagittal section through the skull. Here's your nasal cavity. Your maxilla, your vomer bone, the frontal bone that has a frontal sinus in it, a cavity, the nasal bone, the parietal bone, the temporal bone, has an internal acoustic meatus. So this is the meatus or the canal by which the vestibular cochlear nerve, which is involved in your hearing and your balance, is going to move through. Hypoglossal canal, which we'll talk about this later, but one of the cranial nerves is the hypoglossal nerve, and it's going to move through this canal, which is in the occipital bone. The perpendicular plates going through the nasal septum. Leo, you can't be right there. No, buddy. No. Right here, all of this bone right here is the ethmoid bone. Remember, that's the really, really thin bone. This cribriform plate has very, very tiny holes in it, which allows for the olfactory nerve to, this is your nasal cavity. So it allows the olfactory nerve to penetrate the little holes of this cribriform plate area and filter into the nasal cavity. Opening up, looking at the interior of Leo, no, base area of the skull. Here's my sphenoid bone, my frontal bone, my ethmoid bone with the cribriform plate. I have what's called the silica turcica right here, which is where the pituitary gland is going to sit in the hypophyseal fossa. The foramen lacerum carotid canal, the temporal bone, the parietal bone. Excuse me, parietal bone, occipital bone. Looking at the internal part of the skull. So this really big hole that's down in the bottom here is called the foramen magnum. Foramen meaning hole. Magnum meaning big, so means really big hole. This is where the brainstem is going to come out. Move through. Some little tiny, I know, well, let me put it this way. I know a really good mnemonic for learning some of the holes in the bottom of the skull. But you have to be able to picture the little saddle right here, the little saddle right there. And it's called the Sella Turcica, which means Turkish saddle. You have to be able to picture a little cowboy sitting there. And he's sitting in that saddle, he's facing forward. He's facing forward in this little saddle right here. As he's facing forward, the optic canal is about right here. And so he's facing forward. He looks out through the optic canal, which is about right here, right here. He puts his lasso into foramen lacerum. He puts his feet or his boots into foramen rotundum, which is about right here and right here. And he spits over foramen ovale, into foramen spinosum. So this cowboy right here looks out through the optic canals, puts his boots into foramen rotundum, puts his lasso into foramen lacerum, and spits over foramen ovale into foramen spinosum. Here's foramen ovale here and foramen spinosum right here. The internal acoustic meatus right here. The hypoglossal canal, you can't really see it here, kind of has an arrow, but it's hard to see it right in here, right on the internal surface of foramen magnum. As part of the face, we have some sinuses. We have the frontal sinus. This is a cavity within the frontal bone. Have an ethmoid sinus, cavities within the ethmoid bone. The sphenoidal sinus. And a maxillary sinus. Little air pockets within the bones that allow the bones of the skull to be a little lighter. They're normally not filled with fluid. They're empty spaces. When you get a sinus infection, that's when they can fill up with fluid. The bone that's in the base of the skull right here is the sphenoid bone. I have a friend, and she's kind of my partner in crime when it comes to anatomy, because she likes anatomy as much as I do. And the reason I got to know her was because she was in one of my anatomy classes at one point. And when she described the sphenoid bone, she described it as a bird on crack. And I think she's right. the more I look at it, the more I can see the bird on crack. The greater wings are the wings of the bird. The lesser wings are kind of the horns of the owl or bird. In the internal surface here, that's where the sphenoidal sinus is within the body of this area. The feet are the pterygoid processes. Foramen rotundum right here, remember that's where the foramen, excuse me, the sella turcica is part, that Turkish saddle is part of the sphenoid bone. Right here. Foramen ovale right here, in between the pterygoid processes. The optic canal. And at the bottom base of the skull, without the mandible. Let's see here. So this figure that we're looking at is looking at this. So anterior surface, posterior surface, foramen magnum, occipital condyles, which is where the first cervical vertebrae are going to sit. The mastoid process, that part mastoid, I don't know if I described it, but mastoid means breast. So it looks like a breast kind of hanging down. Carotid canals, where the internal carotid artery is going to enter. The jugular foramen, where the jugular vein moves through. Styloid process, that little sharp point. The mandibular fossa, where the mandibular condyle of the mandible is going to articulate. Foramen ovale. Foramen lacerum. Right here, right here. The palatine bones right here on the very posterior end of the palate. When we're looking at this right here is the pterygoid processes of the sphenoid bone. Right here, looking at them from an inferior view. Any questions?
No.
Just a little bit of a review, looking at the mandible and looking at it by itself. The ramus, here's the mandibular the condylar process. No, that's not right. You guys, we called it the mandibular process, call it the mandibular condyle. Either name works. I would call it the so this condylar process is the same thing as the mandibular condyle. The coronoid process, alveolar processes, the mental foramen. Towards the very end here, we have a mental protuberance, the very pointy part of the chin. The mandibular foramen is where a nerve of what's called the trigeminal nerve, a branch of the trigeminal nerve is going to enter. This is the nerve that is anesthetized when dentists want to work on the bottom teeth. Moving on, the thoracic cage, which includes the ribs and the manubrium and the vertebrae in the back, thoracic vertebrae, manubrium, the body of the sternum, and the xiphoid process, meaning a sharp point, a sword-like point. The name sternum, if I remember right, or maybe I'm not, I might not be remembering it right. Oftentimes we call the sternum a sword. The manubrium is a handle. Here's the body of the sword. Here's the tip of the sword. The rib cage, there's 12 ribs, typically 12 ribs. 7 of them are true ribs. What that means is that they articulate with the vertebrae and articulate with the sternum directly via their own costal cartilage. There's three false ribs, ribs 8 through 10, which which articulate with the vertebrae, but they merge into the one costal cartilage to articulate with the sternum. That's why we call them the false ribs. True ribs articulate directly with the sternum through their own articular cartilage. False ribs articulate with the vertebrae, but merge into one costal cartilage to articulate with the sternum. Floating ribs never articulate with the sternum. And there's 2 of those. When looking at the ribs, the neck, or excuse me, the head is what's going to articulate with the vertebrae. There's a little bump here, the tubercle. Then there's the body of the vertebrae. And then there's, we can call this the sternal end of the vertebrae. So the head articulates with the vertebrae, tubercle, And then this part articulates with the ribs. If it's going, excuse me, articulates with the sternum. Looking at the vertebral column, we have 7 cervical vertebrae, 12 thoracic vertebrae, 5 lumbar vertebrae, and 5 sacral vertebrae. How are you going to remember these numbers? Let me ask you. So we have class at 9:30 in the morning. That's really early for me. I don't know about you. But what time do you typically eat in the morning? What time do you typically eat breakfast?
Never.
All right, that
don't.
Miranda, you got to give me an answer, not never. That doesn't work.
Like 8:30.
I was gonna say
Okay.
brunch.
All right, why don't we say Miranda and Quentin eat at 7 in the morning? I know that's
Okay.
really early. There's 7 cervical vertebrae. If you eat at 7 in the morning, what time do you typically eat lunch?
12.
There's 12 thoracic vertebrae. What if you eat lunch at 12, what time do you typically eat dinner?
5.
Would it be 5 then?
Let's go with 5. You obviously Quentin doesn't really eat at 5. He's saying we
Yeah,
can
no.
go. All right.
I do.
You do. Okay. And this is Michaela. So Michaela eats dinner at 5. So we have 5 lumbar vertebrae. Little differences between these basic 4 types of vertebrae. Excuse me, 3 types of vertebrae. We didn't talk about the sacrum. There's 5 vertebrae in the sacrum. The cervical vertebrae have a bifurcation of the spinous process. This is what you can feel on the back of people, spiny spine, the spinous process. On the cervical vertebrae, the spinous process is often bifurcated. Also, there's transverse foramina here, for which what we call the vertebral artery is going to move through up to the brain. The vertebral foramen is where the spine is going to move through, the spinal cord. The body of the vertebrae is where the individual vertebrae meet, that's got the intervertebral cartilage between them, or the fibrocartilage discs. Cervical vertebrae, bifurcated spinous process, and transverse foramen. The way that I distinguish thoracic vertebrae from lumbar vertebrae is thoracic vertebrae have 5 ends. Actually, it should have 5 ends, but you don't see them here. Let's say it has 3 ends. 1, 2, 3. The lumbar vertebrae has 5. 1, 2, 3, 4, 5. If we were looking at an individual vertebrae, the thoracic has 5, the lumbar has 7. That's the way that if you're looking at if you only have one vertebrae, that's the way you can identify them as either being cervical, thoracic, or lumbar. The first two cervical vertebrae are a little unique. We have the C1, cervical 1, which we call the atlas because it's holding up the skull. Have an axis, which is what the C1 is going to rotate on. Allow you to move your head and say, no, I don't want that. Because this little process that's part of the C2 vertebrae articulates with the C1 vertebrae and allows you to rotate your C1 vertebrae on top of your C2 vertebrae. It's a little pivot point. So, and this dens means tooth or odontoid process. It's going to articulate here and allow you to say that you don't like something by nodding your head back to the left, to the right, and to the right. Some abnormal curvatures that can be observed in the spine. Scoliosis, meaning an indentation to the side, curve to the side. Lateral curve. Kyphosis, meaning an abnormal curve of the cervical vertebrae. Forward, an anterior, so an anterior curve of the cervical vertebrae. Lordophosis is an anterior curve of the lumbar thoracic vertebrae. So scoliosis is more of a side curve. Kyphosis, anterior curve of the cervical vertebrae. Lordosis is an anterior curve of the lumbar vertebrae. Moving on to the appendicular skeleton, which doesn't have as much detail as the skull does, and the axial skeleton does. The pelvic pectoral girdle is your shoulder joint, your clavicle, which has a sternal end and an acromial end, which articulates with the acromial process of the scapula. You can often see it on people. If I know I can feel it on me, because here's my clavicle right here. It goes all the way up. And if I keep feeling it up, keep feeling it here, right here, it articulates with the acromial process or the acromion of my scapula. And the sternal end of the clavicle, meaning it articulates with the sternum. And the head of the humerus is going to articulate with what's called the glenoid cavity of the scapula. Looking specifically at the scapula, the front view, the anterior view, has a medial border, meaning towards the medial side. So looking at my little tiny mini skeleton here. Medial border lateral border, the spine of the scapula. Looking at the back. So right here, we're looking at the back because the front would be on this side, underneath the vertebrae. Right here is the subscapular fossa. It's not named here. But that area right there is a subscapular fossa. Which is on the anterior view of the scapula. Scapular fossa. So subscapular fossa. The coracoid process and the acromion process. Coracoid, acromion. The glenoid cavity here is where the head of the humerus is going to fit. Scapular notch up here on top. Infraspinaous fossa. Here's the spine. Below it, the infraspinaous fossa. And the supraspinaous fossa is above the spine. Looking at the humerus, the head of the humerus, remember how it's going to articulate with the glenoid cavity. Head of the humerus, the greater tubercle, you're going to often see on people too, and the lesser tubercle. Greater tubercle, lesser tubercle. The anatomical neck is the area right underneath the head. The surgical neck is where we tend to break the humerus. If we're going to break the humerus, we're not going to break it on the anatomical neck. We're going to break it on the surgical neck. That's why it's called the surgical neck. This intertubercular groove in between the greater tubercle and the lesser tubercle. Can often see if I'm kind of bony, so I can feel it really well. About right here is on the back is my greater tubercle. Great, about right there, greater tubercle, lesser tubercle right here, and the intertubercular groove. When you flex up your shoulder, you can often see that little groove right there. That's your intertubercular groove. Deltoid tuberosity, where the deltoid muscle is going to insert. The lateral epicondyle and the medial epicondyle. lateral epicondyle, medial epicondyle. Excuse me. The coronoid fossa is going to articulate with the coronoid process of the ulna bone. The radial fossa is going to articulate with the radius, with the head of the radius. The trochlea is going to articulate with the trochlear notch of the ulna. The capitulum is going to articulate with the head of the radius. The olecranian fossa is going to articulate with the olecranian process, which is essentially your elbow. This little bony bump right here. So on the ulna, the trochlear notch articulates with the trochlea of the humerus. The olecranian process, which is your elbow, your coronoid process, the head of the radius, the radial tuberosity, and on the bottom of each of these bones, or on the distal end of each of these bones, the styloid process of the radius and the styloid process of the ulna. These little sharp tips. Showing how they articulate. So coronoid process articulates with the coronoid fossa articulates with the coronoid process of the ulna. Trochlear notch articulates with the trochlea of the humerus. The head of the radius articulates with the capitulum. The lateral epicondyle, the medial epicondyle. Any questions about the humerus, the radius, and the ulna? Wrist bone, or hand and wrist. Wrist is the carpals. Metacarpals, phalanges. I think this is a lot for one lab. I'm going to extend out the deadline for this out another week. Let's finish this next week. Let's go over some of this. I'm going to give you, if you want to get ahead, I'm going to extend out the deadline for the appendicular skeleton. So that would be at lab exercise 10. Because I think this is a lot of material and I don't want to keep going here. I think you've already got enough to know. So I'm going to extend out the lab quest for another week. The lab quest 3 that's opening today, I'm going to extend it out another week. The lab exercise 10, I'm going to extend out another week. 8 and 9 are still due next week. Those are the axial skeleton and the osseous tissue and the long bone anatomy. but I will continue with the appendicular skeleton next Thursday. I just think this is a lot of material, and I don't know if you're feeling a little overwhelmed. I think this is a lot. I want to show you two things though first. And then we'll finish the appendicular skeleton next week. But I want to show you two ways, because you are going to be asked to memorize the carpal bones and the tarsal bones in order. And I know of a few good mnemonics for remembering these bones. This one, and I'm glad my mom's locked in her room, because if she heard me, she'd be like, Mary, I can't believe you just said that. The one for the carpals is some lovers try positions that they can't handle. Well, that is scaphoid, some, lunate, lovers, triquetrium, positions, the pisiform that's on the opposite side here of this bone. That, trapezium, they, trapezoid, can't, capitate, handle, hamate. Bear with me, I'm going to type that up just a sec. Here. So some scaphoid. Actually, let's do this. Some lovers try positions that they can't. So with this scaphoid, lunate, triquetrium, pisiform, they, excuse me, trapezium, they, trapezoid, can't, capitate, stretch this out a little bit. I'll shift gears real quick. And then I'm going to show you one more mnemonic. So if you want to work ahead, you can. I'm going to come down to the tarsal bones. So that now we're looking at the foot here. So the calcaneus is your heel. The talus, the navicular, the cuboid, the lateral cuneiform, the intermediate cuneiform, and the medial cuneiforms on the other side. So if I'm looking here, talus, calcaneus, navicular, cuboid, medial cuneiform, lateral, intermediate cuneiform, lateral cuneiform. The mnemonic that I know best for this one is tiger cubs need milk. So calcaneus, oh wait, tiger, talus, cubs, calcaneus, need, navicular, milk, spelled with a C. Medial cuneiform, intermediate cuneiform, lateral cuneiform, cuboid. So tiger, cubs need milk. M-I-L-C. And this means talus, tiger, talus, calcaneus, need, oh, excuse me, navicular, medial cuneiform, medial cuneiform, I think that's how it's spelled. Intermediate cuneiform. Lateral cuneiform. Cuboid. So tiger cubs need milk. Talus, calcaneus, navicular, medial cuneiform, intermediate cuneiform, lateral cuneiform, and cuboid. So I will put out an email announcement that we will finish lab exercise 10 next week. And I will extend out the lab quest. I'll still let it open today, but I'll extend it out another week. So it won't be due next Wednesday night, but it'll be due the following Wednesday night. Lab exercises 8 and 9 are still due next Wednesday night. Lab exercise 10 won't be due until the following week. Are there any questions?
Just wanted to triple check. So Lab exercises 10, that's 2 Wednesdays from now. Lab quest 2 is the 18th. Exam 1 is the 20th.
Lab quest 3. Wait, I'm sorry, bear with me. Did lab quest 2? Give me one
Lab
moment.
quest 2 is due, what, because you were talking about 3, but that wasn't even like a sign, like we
Yeah,
hadn't.
it only opens today. I'm sorry.
Okay.
So lab quest 2 to do the 18th. Okay, keep going, Terry. I'm sorry.
No, that's fine. So I just wanted to triple check. So lab quest 2 is due the 18th. Exam 1 is due the 20th. Which, that's, what day of the week is that? Sorry, I don't have a calendar.
Wednesday.
Okay, so yeah, that's due Wednesday with exercises 8 and 9.
Yes.
Okay, cool.
And I will, I'll put this all out in an email tomorrow. That we're changing some due dates around here. Because, yeah, going through all that material and realizing just how much there is. And I think that's a lot of material to cover in one day. So let's, it's always a lot of material, but that's a lot of material for just one day. Have a wonderful day, okay?
Thank you, you too.
Bye.
Bye.
Professor, before you end this,
Yeah,
I'm gonna ask, did you get my email? Because I did just email you about extending my
I
lab.
haven't, I tried not to look at them very much during class, but
Okay.
did you just send it to me just now?
No, I sent it to you a little bit earlier.
What, during class, or was this one that you sent me last night?
No, during class.
Okay, I try not to check them during class.
Okay.
What was it about?
Just because I did get in that accident and stuff, it completely slipped my
Yeah.
mind. It was due Wednesday. I was just asking for an extension on it.
Yes, lab exercise 7, is that
Yes.
right? Yeah, I can do that. I'll extend it out another week,
Okay. Thank you very much.
of course.
It was such a mess.
I can't imagine. That really sucks.
Yeah, it does. And the car market sucked so bad. So I had to jump on what I had to jump on when I could get it.
I understand that.
Yeah. Oh my gosh. Thank you very much. You have a good day.
You too. It's so irritating. Jesse, are you still there? Lakeisha and your guest, are you still here?
I'm here.
Okay. What's up?
Nothing. I'm just trying to do something on the laptop and then I'm gonna get off.
All right. I'll see you later, okay?
All right.